Good morning. This is Dr. TK with Providence Primary Care in Jacksonville, Florida. Thank you for joining me again for Morning Coffee with Dr. TK. Today, we're actually going to talk about skin cancer. So, with spring break right around the corner and soon after is summer break, it's important that we understand how to screen our own skin so we can early detect any changes that may be skin cancer, as well as ways that we can prevent skin cancer. Now, melanoma is the most commonly known skin cancer, and it's certainly considered the most dangerous of the types. But there's also a group of non-melanoma skin cancers that are the most common overall. The first is basal cell carcinoma. Then there's also squamous cell carcinoma and lesser known Merkel cell carcinoma. All of these skin cancers, including melanoma, are due to cell damage in the skin caused by chronic and prolonged exposure to UV rays. UV stands for ultraviolet, and of course, it comes from the sun. Now, there are two types of UV rays. There's UVB, which has a shorter wavelength and is what causes the skin to burn. And there's UVA that has a longer wavelength, and that contributes to aging of the skin. In all types, the recommendation to prevent any skin damage is sunscreen with a minimal SPF of 30 and also wearing protective clothing. You want to do this especially during the hours of 10 a.m. to 2 p.m. when the sun is at its peak. Now, there are some people who have, a higher risk of skin cancer. They include those with the family history of skin cancer. They have fairer skin and also may have a weakened immune system. So, with regards to screening, you basically want to perform a self skin exam at least on a monthly basis so that you can become familiar with the mapping of your skin, if you will. And from month to month, you can note any changes that may occur. So, an easy way to do this is to follow the ABCDs of skin cancer evaluation. The A stands for asymmetry. So, as you look at the mole, does one side look the same as the other? Or is it smaller in size or somehow irregular? So, you definitely want symmetry. The next thing is B, it stands for borders. As you look at those skin moles and freckles, are the borders or margins irregular? Are they indented? And when did this change occur? So again, we're looking for changes that may be happening in the skin. The C stands for coloration. So you want to note, is there more brown discoloration? Is there more variation that's happening in the skin? Are we now seeing some red or blue or white hues? And do we see even more darkening? Do you see any black discoloration in the skin? Because that is also a concerning sign that there may be some skin cancer developing. And then the D stands for diameter, and that very much refers to the size of the lesions. So, are you noticing now an increased size? Is the diameter 6 millimeters or greater? And that's about the size of the head of an eraser on a pencil. So, if you notice any of those changes, this is certainly something you need further evaluation from your family doctor or dermatologist. And I also want to note that there may be some skin changes that don't fall into those ABCD categories, but can still be concerning. For example, I mentioned diameter. So, you may be thinking of increased width, but it could be that there's a height change. So now that this lesion is more puffy or raised as opposed to being flattened. And it could be that you have a sore that's not healing. You would expect that there will be some scab and some healing taking place within 5 to 7 days, but you notice that you continue to have an open wound, maybe some oozing or continued bleeding. So these are all things that need to be further evaluated. And finally, before we wrap up, occasionally I get the question, well, I'm Black. I'm a person of color. Do I really need to wear sunscreen? Well, the short answer is yes. So even though people with melanated skin have a natural protection against the sun and its rays, our natural SPF is only about 13. So if an SPF of 30 or higher is recommended to prevent the harmful effects of both UVA and B waves, definitely if we are going to have prolonged or chronic sun exposure, it is important that we wear sunscreen. So overall, yes, it is a universal recommendation. We can all benefit from wearing sunscreen to protect against the harmful effects of the sun, and as well as just to kind of slow down the aging process a little bit. So that's our morning talk. If you have any questions, you can always email us. You can reach out to us through Facebook or our website. And again, I appreciate you joining me. And if you have any questions or suggestions for another talk, I'd love to hear them. www.providencepcjax.com. Thank you.